Okay, welcome back. I just wanted to apologize that the last lecture was so long, but CNS depressants was a large category. Now we're going to move on to talk about CNS stimulants, which is a smaller category containing cocaine, amphetamines, and hallucinogens. Okay, so we'll start with cocaine. Cocaine is a purified extract from the leaves of the coca bush. Different chemical processes produce the two main forms of cocaine. Powdered cocaine, which is called coke or blow, which is dissolved in water and typically snorted or injected. Crack cocaine, obviously called crack or rock, is made by a chemical process that leaves it's in its freebase form and is often smoked. So prescription amphetamines we often use for such disorders as obesity, Parkinson's, ADHD, or narcolepsy. So some common medications in the amphetamine category are Adderall, Strattera, and Vyvanse. Now, street amphetamines are often called bennies, black beauties, eye openers, lid poppers, pep pills, speed uppers, wake ups, and white crosses. Street amphetamines or methamphetamines are things like called crystal, and so you may have heard the term crystal meth. Now, methamphetamines are illegal, obviously, and usually they are produced by chemically altering cold tablets, alcohol, lithium in batteries, and the deadly ammonia. Okay, so this combination is used to make this crystal or crystal meth. Methamphetamines, or called speedballs, sometimes are combined with heroin. And remember from our last lecture, heroin was the opioid which caused that euphoria feeling. So when you combine the methamphetamine and heroin, you're getting the stimulant effect and the euphoric effect. Okay. There's something else that I wanted to talk about, and that's called bath salts. You might have heard that term before, and they're not actually salts used in the bathtub. What they are synthetic stimulants that are made from an African plant called the cat plant. And what the bath salts do is cause euphoria and alertness. They are usually inhaled, ingested, smoked, or injected. And what happens is it causes increased blood pressure, hallucinations, and extreme paranoia. So these bath salts, the onset is within 15 minutes and can last for up to 4 to 6 minutes. And the bath salts are becoming a huge community concern for our youth. So if we look at CNS stimulants, CNS stimulants range from mild caffeine and nicotine up to the illegal substances such as cocaine and amphetamines. You can see some of the statistics on the slide for you, but stimulants, again, bath salts, cocaine, methamphetamine, and ecstasy and LSD all fall into this CNS stimulant category. Cocaine is highly abused. It exerts those two main effects on the body that anesthesia effect by blocking the conduction of the electrical impulses through the nerve cells, and that stimulant effect which causes that arousal and sometimes violent behavior in these patients. Stimulants, most methamphetamines, the crystal meth, in Wisconsin are manufactured outside of the state, but we are seeing more and more incidents of methamphetamine labs in our common kitchens and sheds, garages, barns, and such in our community. Manufacturing of methamphetamine The manufacturing causes dangerous conditions, environmental conditions, and are a very huge public health concern at this point. Because of the way that it's made, it causes many toxic byproducts, and usually homes that are found to be methamphetamine labs are so contaminated with these biotoxins that they have to be destroyed, just completely destroyed. And if you think about the effect that it has on the children that have to live in those environments where the parents or caregiver may be producing or a methamphetamine or having a methamphetamine lab in their home, it causes a huge risk for these children. And because of the way that it's made, crystal meth is never pure. It is so dangerous and associated with so many effects, which we're going to see here in a minute. So what are the routes of CNS stimulants? We can have oral route. Again, it can be inhaled, it can be smoked, snorted, and in extreme cases used as IV injection. When crack is smoked, it takes effect in about 4 to 6 seconds, producing that high followed by a period of deep depression, which just goes to reinforce that addictive behavior to want to have more drug to get back to that high that they experienced. Methamphetamine looks like a clear crystal rock. It is most oftentimes smoked, vaporized, and inhaled in some type of a glass pipe. And this allows for quicker absorption into the bloodstream and it is not associated with all those risks of injecting. Now, methamphetamines that are inhaled can last up to 12 hours for the person. So sometimes this is a route that is preferred by abusers. Okay. The IV injection obviously would have an instantaneous effect going right into the bloodstream and is the route that is more often associated with causing death of all the routes. So what's going on with the neurotransmitters with the CNS stimulants? It's affecting dopamine, serotonin, and norepinephrine. And it gives that effect of euphoria, that hyper alertness. Sometimes these people have that grandiosity, thinking they can do anything, increased energy, so they may be, up for hours and just be able to sustain this high for a long period of time. Side effects of these CNS stimulants is going to be hypertension, tachycardia, dysrhythmia, seizure activity, and of course HIV and hepatitis, if they're using the IV or needle route, is a definite side effect or undesired side effect of this medication. But if you can think about this logically, if we're stimulating the CNS system, we're stimulating all the systems in the body, and they're on hyper alertness. Okay. So when the nerve cells in the brain and the spinal cord are activated by the amphetamines, mental focus and the ability to stay awake and concentrate is improved, which is helpful for that. Which is helpful if we're trying to use it therapeutically for patients with ADHD or narcolepsy. The imbalance that occurs in the neurotransmitters between dopamine and norepinephrine is responsible for the many physical withdrawal symptoms that we're going to see when the person stops taking it. We're going to see depression. So think opposite of stimulant. The side effects are going to be depression, paranoia, lethargy, insomnia, nausea, vomiting, maybe some sweating, intense craving for the drug, okay? They want to get back to that feeling good and get out of this feeling terrible. The effects of the amphetamines and cocaine are similar. They last for several hours. And when mixed with alcohol or other drugs, the effects of the amphetamines are enhanced. Again, it does cross the placental barrier, so in pregnancy and nursing women, it can cause effects on the child also, and what those effects are basically the same addictive and withdrawal symptoms that you're going to see with the abuser. So here is a fine gentleman depicting for us all the effects that cocaine have on the body. You can see these for yourself. You can read them, but basically you're going to get dilated pupils, high energy levels, high activity, excitability, and exacerbated speech. Okay. When you see a person who's taking crystal meth, some other physical symptoms that might be obvious to you would be poor dentation, because the acidity of the methamphetamine actually destroys the enamel on the teeth, and so you're going to see somebody's going to have really poor dentation. You might also see that they have sores on their arms because methamphetamine causes this pruritus feeling in people, and so they often itch and cause sores on themselves. They're often very thin because of the increased metabolism and the less likelihood that they're going to be eating appropriately. So here is a depiction of some of the effects of methamphetamine. The effects on the brain actually can cause toxic psychosis, and this can last for months to years after they stop taking the drug. Okay, also can cause paranoia, hallucinations, and delusions. They can have poor coordination and repeated motor activity. Cardiac and respiratory wise, it's a stimulant, so it's going to cause that pounding heart rate, some cardiac dysrhythmias. They may have some shortness of breath. It may precipitate seizures and convulsions, even to the extreme of coma and death. Again, nutrition-wise, these people aren't going to be eating. They're all wired up. So you're going to have malnutrition and weight loss. Again, meth mouth, that decaying of the teeth, possibly some ulcers in the esophagus and stomach. Again, skin disorders, they may have flushed skin. They're going to have that sores on their body. And it actually can cause muscle breakdown called rhabdomyolysis, in which can lead to kidney damage and failure. So withdrawal and treatment, we want to be watching temperatures. Temperatures can get extremely high when these people are withdrawing from the CNS stimulants. So we want to be watching temperature and providing for fluid balance. Patients with cocaine toxicity may be combative, they may be aggressive, disoriented, and unsafe to themselves or others. There is no antidote for CNS stimulants, okay? So you want to remember that there is no antidote like there was with the CNS depressants. Again, withdrawal symptoms are going to include depression, maybe some paranoia, fatigue, lethargy, difficulty concentrating, irritability, and that increased craving, which is going to make them want to seek out the drug. Specifically, users of bath salts indicate that they don't get that hangover effect the next day like all of the other CNS depressants. So that is one thing to keep in mind regarding the bath salts. But they will get the crash that is common with CNS stimulants, excuse me. So let's talk about the phases of withdrawal. There are 3 phases. The first one is the crash phase, and this can last up to 4 days. So users are going to report depression, anergy, acute onset of agitation and depression, and that extreme craving for the drug. Phase 2 is more of a prolonged sense of feeling unwell. They just don't feel right. And this can go on for up to 10 weeks. And that intense craving is going to last for up to 10 weeks also. So phase 2 is typically the phase in which you're going to see the relapses occur. And then with the phase 1 withdrawal to happen all over again. Phase 3, this is the phase where the cravings are starting to subside. They're more intermittent, and this phase can last indefinitely. So it's kind of like with your alcoholics, right? They are always, for the rest of their life, going to have the risk of falling off the wagon. I'm sure you've heard that term used before. So what are our priorities regarding treatment? The ABCs are going to be our number one priority for intervention. We're going to want to be providing oxygen, concentrating on that fluid and electrolyte balance, monitoring vital signs, including the temperature. So again, we can have hyperthermia with patients who are withdrawing, and this is typically secondary to agitation and that prolonged fighting. Okay, temperatures can reach critical levels, which require us to do close monitoring and early intervention. So excessive demand on the muscle cells can lead to the rhabdomyolysis, which thus leads to a seizure and kidney failure. Glucose levels for patients are also very important to be monitoring, because as the body is working so hard, we are using up a lot of glucose for those efforts. We can, even though there is no antidote, we can treat symptoms. So again, we're going to want to be giving the benzodiazepines to manage that seizure threshold and just to help calm these people down and deal with the anxiety and agitation that they're experiencing. Okay. So most often when we're talking about cocaine withdrawal, we want to be monitoring patients for the tachycardia and hypertension that goes along with that, and try and keep them calm and reduce external stimuli. Methamphetamine withdrawal, again, is going to be supportive. There has been some animal studies that have suggested that compounds such as activated charcoal given orally can assist in decontaminating the patient who's been using methamphetamines. So again, we want to be correcting for hypertension, hyperthermia, metabolic electrolyte imbalances, and try and control those psychiatric agitation by decreasing the stimuli in the environment. Okay, so let's talk real briefly about hallucinogens. Hallucinogens are those psychedelic drugs that are used to alter our perceptions of reality. Okay, hallucinogens, there are no medical uses that we use these for, so it's strictly used for illegal use by abusers. Ecstasy is the most common psychedelic drug that is used, and ecstasy is also called that drug called date rape drug. So some common forms of hallucinogens are LSD, peyote, mushrooms, and PCP. LSD is one of the most potent mood-changing chemicals. It's manufactured from lysergic acid, which is found in a fungus called ergot that grows on rye and other grains. Peyote, comes from a small cactus, and the principal ingredient there is mescaline. The plant has been used by Native Americans in northern Mexico and the southwestern United States as part of a religious ceremonies for some time. Mushrooms, the other name for mushrooms is, and I can't say it, psilocybin. I just call them mushrooms because I can't say that other word. So mushrooms are indigenous to the tropical and subtropical regions of South America, Mexico, and the United States. That's how they're obtained. And finally, PCP is an intravenous anesthetic. It is used and has been used, began being used in the 1950s, but then was discontinued due to its serious side effects. But it has prevailed as a illegal substance of abuse. So what is the chemical consistency of the hallucinogens? They alter the level of consciousness and induce hallucinations, obviously, that resemble psychosis. Primarily, they bring on alterations in thoughts, perceptions, and feelings that normally only occur in a person's dreams. PCP acts mainly through a type of glutamate receptor in the brain that's important for perception of pain, response to the environment, and learning and memory. LSD has been found to work on the serotonin levels in the brain. So LSD, these what they call trips, can last up to 12 hours in length. Peyote, its effects again last up to 12 hours. Because the extract of peyote is so bitter, most often people will boil this into like a tea to ingest to try and offset that bitterness flavor. Mushrooms, the effects of mushrooms can be within 20 minutes when they're ingested, and they last approximately 6 hours. And then finally, PCP is a white crystalline powder that is readily soluble in water or alcohol. So PCP is most often smoked. It's applied to leafy materials such as mint or parsley or oregon or marijuana. Okay, and depending on how much and the route that the PCP is used, its effects can last approximately 4 to 6 hours. If it is ingested, the symptoms typically occur within 1 hour. And if it's IV or smoked, the results are as quick as within 5 minutes. So here again, we have this fine gentleman showing us all the effects of LSD on the body. And the most important is, I would say, the acute panic reaction that is exhibited with toxicity. And this can result in psychosis. It can have brain damage and even death for the person. So what you're going to see is dilated pupils, tachycardia. Again, we're stimulating. We're going to have sweating, palpitations, tremors, incoordination, okay, and elevated temperatures, pulse, and respirations. Stimulant, remember that. So if you're having trouble remembering the effects of these different drugs, always think stimulant. And what is a stimulant going to do? The mental effects from these drugs are going to be this feeling of fear and like they're going crazy. They may have paranoid ideas, anxiety. They will see colors. They will hear things. They will see things. That's the hallucinogen part of it. Okay. Overdose, again, is going to cause psychosis, brain damage, and death. I'll let you go ahead and review this slide. Basically, it's kind of what we just talked about. So how do we treat these people? We, as nurses, are going to monitor vital signs very closely. We're going to decrease stimulation in the environment to try and calm them down. We are going to be protecting them from hurting themselves or hurting others, because their perception when they're having hallucinations is skewed, and therefore they are at risk for homicide or suicide. We're going to monitor behaviors. We're going to, after they have come out of the effects of the medication, we're going to educate them on the effects it has on their body and the possibility that they may have flashbacks. Obviously, we are going to be referring them to treatment and psychotherapy to teach them coping mechanisms from withstanding and building that support system so that they can continue to sustain abstinence from these drugs of abuse. So drugs that we can give them are going to be aimed at managing symptoms of the withdrawal. Again, we're going to be using the benzodiazepines to control that agitation and seizure threshold. We may use some Haldol to treat the behavioral disturbances or the mental disturbances that they're experiencing, and then some Valium also. Okay, so that ends CNS stimulants. Next lecture is going to focus on marijuana, inhalants, and tobacco.